and welcome to the Dr. Bob Show. Have you ever wondered if you have gluten sensitivity, if you have gluten intolerance, if you have celiac disease? You know some friends that have tried a gluten-free diet and they've gotten better. Do they have celiac disease? Do they really need the gluten-free diet? Is it really helping them? How does it help? Boy, do we have a million questions, and we're going to have great answers. I've looked so much forward to this show. My guest is Dr. Johnny Altawil. Dr. Altawil is a board-certified gastroenterologist, stomach specialist. In addition, he has advanced board acceptance in nutrition and also board-certified in obesity. So he's got more accolades than anybody in medicine. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about shingles. We've talked about it before, but there's some new information on shingles that's going to really make you feel good. And type 2 diabetes. If somebody just has a mildly elevated blood sugar, why do they call it diabetes? Do they need to call it diabetes? A lot of information for you. You're really going to want to stay tuned. We're talking with Dr. Johnny Altawil, board-certified gastroenterologist, board-certified in nutrition, board-certified in the treatment of obesity. And we're going to be talking about celiac disease, gluten problems with gluten. Welcome to the Dr. Bob Show, Johnny.
Thank you so much, Dr. Bob. Honored to be here.
So tell me, what is celiac disease?
Celiac disease, it's a long-term illness that affects the small intestines in people who are genetically predisposed to the condition. It causes stomach issues and also issues outside of the stomach throughout the body.
So if it's a chronic illness and it's causing problems in the abdomen, lots and lots of people have irritable bowel, they have GI problems. How do you know if it's celiac disease?
Celiac disease, it's a true allergy to gluten.
Gluten, what is gluten?
So gluten is a term used to describe family of proteins that are stored in a lot of grass-based grains. There are multiple glutens. These proteins are stored inside the plants and they help the plant grow. They feed the plant while growing. It helps the plant and the food keeps its characteristics. It works like a glue, keeps the food together.
What's going on? How does gluten work on hurting the body?
That's a great question. There are a lot of intolerances and effects that gluten can affect the body through. The main one is celiac disease. It's a well-defined illness and it's an autoimmune disease. And then people, they might have some intolerances if they don't have celiac, and even they can have allergy. For celiac disease, when people eat gluten and the body digests the gluten and then it passes throughout the stomach to the small intestines, the gluten starts a cascade of events that leads to destruction of the small intestines.
So that's the celiac disease where the gluten begins to, or trying to digest the gluten, or gluten products cause damage in the small bowel?
That is exactly true. Once gluten is hard to digest, and once the body breaks the gluten into small pieces, these pieces find a way of going through the wall of the small intestines. Our small intestines are very long. They have like a finger-like projections, and these are very important to digestion because they increase the surface of the small intestines.
Sure.
Once the gluten comes, it finds its way going through the inner layer. It gets inside the intestines, then the body produces enzymes to try to break it. Once the body breaks it, then the byproducts of these small gluten proteins gets picked up by special cells that only genetically predisposed people have it. And it picks it up, and then it takes it to what we call it lymphocytes, the sites that, the cells that are responsible to fight infections and protect our body. But
so how does that bother the small bowel?
because these cells are, the job of these cells to be a guard to protect the body, then they start producing a lot of chemicals to try to fight these foreign proteins. And these chemicals lead to destruction of the cells, lead to destruction of the barrier, and then they bring more cells. So it's kind of a circle. It keeps going and leads to destruction, leads to even what happens eventually, these projections thin out, and the intestines become so flat and even kind of they start to form some furrows, and the absorption gets so bad, people start losing lots of micronutrients even.
So there's where the problem is. You start having constipation or diarrhea and you lose nutrients. What are the symptoms when somebody has celiac disease, the autoimmune disease?
With celiac disease, multiple symptoms happen, especially gastrointestinal symptoms. The main symptoms is a chronic diarrhea. People have big volume diarrhea. They have many bowel movements throughout the day. The bowel movements are typically watery, foul smelling. They also complain of bloating, gas, irritability. They complain of abdominal pain. It can be dull pain, the stomach ache all the time. Main symptom is loss of energy. They feel weak, they feel tired, they don't have much energy to perform tasks and so forth. They get sometimes nauseated. And then so you have symptoms from loss of nutrients. And when you start losing nutrients, you become anemic, or you start having neurological issues, or you start having even skin problems. There are skin changes that happen with celiac disease. The most common one is called dermatitis herpetiformis. It's basically celiac disease. It's a rash that happens in the body.
If you've got a GI tract that's being destroyed by antibodies coming into it and you're losing nutrients, how do you make the diagnosis?
So diagnosis can be made through either blood testing, biopsies, or even genetic testing. We typically use a combination of the above. We don't like to go invasive in every patient. So usually if patients don't have high risk to have celiac disease, like someone doesn't have a family history, we're not very convinced, we start with the blood work. We test antibodies to some of those components of the process. And if the antibodies are positive, then we proceed with doing an endoscope. It's a procedure. We put patients to sleep and we run a camera and a light down their throat to the stomach and then pass to the small intestines. We obtain tissue. We get a lot of tissue. We examine it and we look for these changes of inflammatory cells, thinning of the lining, and inflammatory components.
So if somebody has that, if you find with scoping that they have celiac disease, that they have the damage, what's the treatment?
Treatment is mainly gluten-free diet.
Now, what is a gluten-free diet? That's staying away from the grains that you talked about?
Yeah, so gluten is found in certain grains. Gluten is found in wheat, barley, rye, some types of oats, and even some other species like triticale and so forth.
Is it hard to stay away from those foods?
It's not that hard, because now our diets are full of other grains and other sources that we can obtain nutrients from. It's not that hard. It takes a lot of work, and it takes dedication. It takes, if it's kids, it takes the parents to change the culture of the diet inside the house, and if it's an elderly, it takes even their children to change their diet sometimes.
If you avoid gluten and somebody makes a mistake, they grab a piece of bread or eat some barley, or if they do something like that, how long does it take before the symptoms come back?
For people who have true celiac disease, after exposure, it takes no sooner than days to weeks before they start having symptoms.
Very, very soon. Do some people respond to a gluten-free diet, but they don't have celiac disease?
Yes.
And that's what we're going to be talking about when we come back. I would almost say hundreds of thousands of people are on gluten-free diets, and it's helping them. So what's the deal? What's going on? Stay tuned. That's the answer we're going to be giving you. We're talking with Dr. Johnny Altawil, board-certified gastroenterologist, stomach specialist, board-certified in nutrition, board-certified in the treatment of obesity. We're talking about celiac disease. It's an autoimmune illness where the body begins to attack itself, producing antibodies that come in and destroy the small bowel, where you lose nutrients, where you get diarrhea, where you also get other generalized symptoms. Dermatitis piriformis predisposes to other illnesses, and now we're going to be talking about other parts of gluten-free diets. Was that a pretty good summary?
That's a great summary.
If somebody thinks they're responding, they say, I'm going to try a gluten-free diet because I've got diarrhea and I don't feel good and I had a little rash. Is it important if they go on the diet and they feel better to know if they've really got celiac disease? What's the deal there?
It's crucial to diagnose celiac disease. When we see patients exactly like this, they come and they say, I did great on gluten-free diet. We say, yeah, that's great, but let's make sure you don't have celiac disease because of the implications that celiac disease could have on their life, on their children, on the risk of having disorders and diseases, and on the risk of becoming low on nutrients, and even cancer.
Even cancer. So if they overlook the possibility of knowing for sure how strict they need to be on gluten-free diet, what are those other things that can occur, you said?
So patients who have celiac disease at a higher risk of having type 1 diabetes mellitus, multiple sclerosis, thyroid problems, inflammation of the thyroid. These are all autoimmune diseases. They can get infertility. It's hard to conceive. Liver disease, neuropsychiatric problems, depression, anxiety, seizure, headache, neuropathy, pancreatitis, liver problems.
So this is big time.
It's a big time.
And there's genetics in this, and that's why it's important. If you think you got it, protect your whole family by coming in and getting the diagnosis. Now, what if somebody gets better on a gluten-free diet and they don't have the autoimmune illness? Why are they improving?
These are the patients that we call them non-celiac gluten sensitive.
Non-celiac
Gluten
sensitivity. So they're sensitive to it.
Yes.
So why do they get better?
We don't really understand why they get better. We have a lot of theories on this. There is a small subset of these patients that are really allergic to wheat, and it's not the gluten, it's something else in the wheat. Then there are also some patients who are allergic to some other carbohydrates that also in the grain, but it's not in a gluten. And we think that might produce some allergic reaction in these people.
Are we able to establish that diagnosis? Are we getting closer to making, we've got laboratory evaluation for celiac disease. Are we getting closer to having something that says, yes, you've got gluten sensitivity, intolerance, allergy to gluten? Do we have a test for it?
Unfortunately not. So these are the patients who have all the symptoms of celiac disease, but they don't have celiac disease on testing. They don't have antibodies on the blood work. They don't have changes on the biopsies. We check their genetics. They're not predisposed, but they have all the symptoms, and then you take the gluten off their diet, they feel perfect. You put it back in the diet, they have symptoms. That's how we make a diagnosis.
So what do you tell that patient?
We tell these patients, that's what you
Stay
have.
away from gluten.
Stay away from gluten. And these patients, they might develop tolerance over time. So sometimes we tell them, yeah, try to go back on the gluten and try to see if that would help you out or not.
What happens if they go on a gluten-free diet, they get better, and they try a half a piece of bread and they seem to tolerate that, but if they eat bread for 3 days, they don't tolerate it. Is there a quantitative evaluation on that where they eat too much gluten, or they just do better staying away from it?
If they prefer to stay away from gluten, that's fine. If they decide they want to try some gluten and they do well on some gluten, that is also okay. Patients have to understand that gluten-free diet has some complications. Gluten-free diet put them at the risk of some deficiencies of some micronutrients, of vitamins, even minerals. Even patients, when they go on a gluten-free diet, there's some studies to say they have maybe higher risk of having heart disease, even a lung disease sometimes. They understand that risk, it's okay.
So they need guidance knowing the risks and the benefits. And the benefits is I feel better. They're on a gluten-free diet. So can you add nutrients to that? You say, I want you to stay on your gluten-free diet. You can cheat if you want a little bit. Now, this is not the celiac disease. Sure. We don't cheat at all. But do you give them, is there a certain kind of gluten-free vitamins to take care of those nutrients?
When I see these patients in the office, I check a whole panel of micronutrients. We check vitamins, minerals, we check liver enzyme, we check a lot of things. And if they become deficient, we supply them with
that should be very interesting to follow those patients. Do you intermittently go and look for those celiac enzymes, again, those blood tests for celiac disease? Or do you say you just keep making sure those nutrients are getting digested?
It's unnecessary to check on these patients with blood work or biopsies because they're typically not going to show it positive because they're avoiding the gluten, which might have caused problems. They really have celiac disease.
Do you find that these patients get better and better?
Sure. These patients can get even better if they start to take some other items out of their diet, like what we talked about before, FODMAPs.
So let's go back and talk about where you can get resources to stay away from gluten. Because when I looked and tried to figure out how I was going to get on a gluten-free diet, I was going to have to go to a specialty segment of a special food store. But now all the other big food chains have gluten-free sections. How do you know if food is gluten-free?
That's a great question. So now it's become so easy to follow on this. Most of people now have smartphones. So I asked them to download an application that will check on the barcode of
What's
anything.
the application?
They can look it up on the app.
Okay, so there are apps for gluten-free diet, lots of them.
Lots of them. They can scan the barcode and it will tell them yes or no. Yeah, it's really interesting.
I wanted you to know Dr. Bob has an iPhone, so he's still staying young. So you can look up an app, you can check the barcode, and it'll tell you. That's amazing.
Yes, and there are stores now that they only sell gluten-free materials. What's even more important, I'm not worried when they eat at the house more than I'm worried when they eat at the restaurants. This is what we call it the cross-contamination, and it happens from preparing the food at the restaurants.
Can you feel free if you ask a restaurant? How do you know if they're saying, oh yeah, we're gluten-free?
I always tell them to ask the restaurant to use a new pan to prepare their food.
The people that are on a gluten-free diet, do they respond well? Are they a fun patient to see? I would think they're getting better and being able to guide them, it'd be the best thing in the world.
They feel great.
Johnny Altawil, you're a great teacher. Thank you for coming to the Dr. Bob Show and telling us the difference between celiac disease and the improvement that some people can get on a gluten-free diet, even though they don't have celiac disease. Complicated type situation that you have made so easy for us, the viewers.
Dr. Bob, thank you very much. Again, it's an honor and privilege to be here. Thank you very much.
You can certainly feel free if you go to the gluten-free sections of your store or get an app, and when you get that, you'll know that you're not getting gluten in your diet, and know that if it makes you feel better under the guidance of your doctor, hopefully a gastroenterologist that's trained in this, like Dr. Altawil, then indeed you'll be able to live that better life. Now you're going to want to stay tuned. We're going to be talking about what the borderline blood sugar really mean. Do I really have type 2 diabetes, and do I really need to pay attention? And something new and exciting with shingles, a devastating illness. You'll want to stay tuned. I want to thank Dr. Johnny Altawil. Wonderful discussion on gluten-free diet, gluten sensitivity, gluten intolerance, and celiac disease. Now for questions from you, the viewer, that I think will be important to your health. Question number 1. Dr. Bob, my sugar is slightly high, but it really doesn't indicate diabetes. Why is my doctor so concerned? Well, we call that prediabetes. The fasting blood sugar has to be 126 in order to be labeled as diabetic. Between 100, a fasting blood sugar, 100 and 126 is prediabetes. We now do a lot of hemoglobin A1C, and so they can also be in a gray zone. So when you're in a gray zone, the 100 to 126, or the gray zone of the hemoglobin A1C, then your likelihood of getting type 2 diabetes go up tremendously. So that's the time that we can attack. That's the time that we can keep you from getting the harmful side effects of diabetes, which is blindness, which is amputation, which is weak blood supply, which is strokes, which is heart attacks. So nobody wants those things. How do we know if we're going to get them? How can we prevent that? Well, if you're in the pre-diabetic phase, that's the time to start losing weight. That's the time to get your blood sugar under control. That's the time to become more active. So the things that we always want people to do on the Dr. Bob Show, that's the time where we need to really get to work. Question number 2. Dr. Bob, what is shingles, and is there anything new that we can do about it? Shingles is a devastating, blistering rash that's in a certain skin dermatome that can be anywhere, usually above the waist on the body. It can be in the face. If it approaches the eye, it's very, very dangerous. The rash usually lasts 4 to 6 weeks. It is a really burning, stinging rash. Well, so what's the big deal? Well, there are 1 million cases in the United States of shingles every year. 15% of those people that get shingles will get post-shingles, after shingles pain. We call it post-herpetic neuralgia. 1 out of 3 people after the age of 60 will get shingles. So we now have a vaccine. It's called Zostavax. Zostavax gives us immunities where we have less chance. But the problem with Zostavax is that it doesn't seem to get a prolonged immunity. And shingles is more common as we get older, and in older people, especially in their 80s, it doesn't seem to give a good response. So there is a new FDA approved and CDC approved vaccine that is supposed to be, it's not available until early 2018, that will give us the titers that we want, that will protect people as they get older. In fact, they now have changed the age to where you'll get the new vaccine called Shingrix. You'll be able to get that at age 50 rather than having to wait to age 60. And it will improve the amount of immunity and resistance that you get. How does it do that? Well, it takes the virus, and let's say this is the herpes zoster virus, and they take just part of that virus and they put on top of that a special protein. We call it a hapten. It's an ASO1. And that makes it where it works so much better. And so when we do get the new vaccine, you'll want to be sure that you get that. It is not out yet at the time of the taping of this show. So keep your eyes on. We'll keep you more and more informed. That's all the time that we have for this show. Remember how important it is to be exercising when you exercise on a regular basis, 30 minutes, 5, 6, 7 days a week. And it will lower your blood pressure, it will lower stress, it'll make you feel better. You'll get that runner's high, your health will improve, it'll keep you from getting type 2 diabetes. Eat properly. We have a problem in the United States, we eat too much food. So look at the amount of food you eat. Eat what you want to eat, have a good time eating, enjoy eating, but make it small amounts and make it frequent. That way your stomach says, I'm full. And when your stomach says, I'm full, then we're not hungry all day and we don't eat big, large meals. Get 7.5 hours sleep. It's so, so important. If you don't sleep well, talk with your doctor about why. If you're snoring and snoring loudly, you may get obstructive sleep apnea. Talk to your doctor about those things. Be sure that you're getting sleep so you'll rest. And most of all, what is it we like in the Dr. Bob Show? You know, it's that laughter in your life. Find that person that you love. Get together, tell funny stories, laugh a lot, giggle a lot, and you will stay healthy.